what Genesis provides for me is the ability to have complete focus on the patient. We know that undivided patient attention is critical to their health, their healing, their well-being, and great adjustments and removing the subluxation.
You got to understand, this is coming from the perspective of somebody who had used 3 other electronic systems in their office for note-taking, for billing, for practice management purposes. And I can tell you that Genesis is going to be the last system that we use, and it's very clear as to why. Genesis, what they've done is, as this software and this program has evolved over the years, it's created a very easy way of not only taking care of the patient, in other words, keeping compliant notes for the purposes of the boards, estate boards, or insurance, if you bill insurance, but also from the purposes of, on the back end, from the assistant's perspective, from the CA's perspective. And those of you guys that are in practice, you know that if your CAs aren't happy and if they're not functioning stress-free, the practice is in chaos. And so the thing that I'm most pleased, as a practitioner, the ease of use on the table is just second to none. But the really exciting thing is having CAs that have been through 3 other systems and seeing them just be able to flow with the system and see the way that's managed the practice and create a less stressful staff. It's probably been the biggest benefit to Genesis being used in our practice that I can think of.
The last system we used before Genesis worked well for the level we were at that time, but it did not give us as many options and avenues, and did not give us as much control management-wise as Genesis does.
If you have a system that is holding you back, you put a baby shark into a shark tank, a fish tank, that shark's only going to grow to the size of the tank. And it's the same with the systems and the procedures we use in our practice. If that system is holding you back, if it's not user-friendly, if it's labor-intensive to both you and the staff, you're just not going to grow.
So the system that I'm using within the office to work with my own team, Charlie trained me on, because that's how he and I communicate. That's how his team communicates.
And that's because we use the same system that they're using, in the sense that when they check in patients and they see patients and bill out a patient, we use the same system. The provider is our patient, so we see the provider, we check in the provider, and we bill out the provider. We see, and it's very similar with the practice. So we're using the same system the same way the practice is using the system. The only difference is they're seeing patients, we're seeing providers.
And so I can tell you with confidence that we've seen this thing evolve for the last 8 years, and as I mentioned before, this is going to be the last system that we ever use.